Okay, where does the pulse come in? What is this pulse? I was reading in this book here, The Inner Physician in You by Dr. Ubletcher, who is the founder of, or the initiator of craniosacral therapy and other related therapies. There's a pulse that is 1 every, or is it 10 every minute?
Yeah, that's on average.
Minute?
It's 6 to 12 times a minute, sometimes a little more, sometimes a little less. But 6 to 12 times a minute is the standard amount of. What happens is that there is like a thermostat has a variability in its temperature. When it gets colder, the thermostat turns the furnace on, and you get an increase in heat, and then it gets warm enough, it turns off, and then it slowly cools down again. Exactly the same system happens inside the craniosacral, what's called the dural tube, or the meningeal tube, the inside the balloon that holds the brain and spinal cord. Is this turning on and turning off of an increase and decrease in the amount of fluid. So it's a pressure stat of fluid. So we have parts of our brain that turn on the production of cerebrospinal fluid, and it increases up to a certain maximum, and then it turns off and it slowly drains down. And where it drains to is basically out of, it's a semi-permeable membrane, so it drains out of the system, and it's reabsorbed.
That's the pulse that you're experiencing there.
That's right, and so it's like a wave, and some people do experience it, especially in between those states of sleep and wakefulness. This feeling of opening up and then closing down, and you think, well, am I breathing? And is this the rate of my breathing? It's not breathing. You think, is this my heartbeat? And it's not my heartbeat, and it is in fact the movement of the craniosacral system, or what's called the cranial rhythmical impulse, or CRI. And our bodies actually respond with a certain movement as well. When it's increasing in volume, we tend to turn our bodies out. All the limbs of our bodies turn out. And we sometimes see people who are sort of stuck like this. These are the people who tend to, have wide round heads, and sort of walk around like this. And then there's also, when the craniosacral fluid is lower in volume, cerebrospinal fluid is lower in volume, people tend to turn in, and we sometimes see people like that, very narrow-headed people who are
kind of
hanging in
constricted.
There. That's right.
What kind of training do you need to have in order to become a qualified craniosacral therapist?
Well, the training is given to people who are already licensed healthcare practitioners, generally. Okay. There are a few exceptions to that, but it's mostly doctors, dentists, physiotherapists, massage therapists, occupational therapists, and so forth, who are primarily people involved in manual or manipulative medicine. Some chiropractors have taken the course.
So these are all licensed professions?
These are all previously licensed professions, and then there's a series of training programs there are 2 basic courses, and then a wide array of other courses, some of which involve more manipulative techniques, some of which involve more elements of transpersonal psychology and that sort of thing.
Now, who can benefit from a treatment? Is it open to anyone? Can children, seniors, adults?
Absolutely.
Male, female?
Everybody.
When would I know that I should come and see you?
Well, I see a wide variety of conditions. I won't say it's a panacea for everything and everybody, but people I've worked on have always felt that there's some profound difference in a sense of relationship to their bodies. I've worked with infants. I've worked with infants who are colicky, and that's often a relationship to a difficult birth, where in the process of birth their heads get stuck, and the relationship of what's happening at the base of the skull to the rest of the spine is impinging on the craniosacral system, and there's quite a movement that needs to happen in there. And that also restless baby syndrome, that sort of thing. Working with children, I've had increasingly recently, actually, I've had a lot of children who are coming to me for attention deficit disorder and learning disabilities. There is in many children a structural element associated with this problem. ADD is a very wide diagnosis, and there are a lot of potential areas for remediation, but generally there is at least some part of it is structural.
Is there any pain or discomfort associated with the treatment?
No, not using 5 grams of pressure. You can appreciate that I'm not going to be imposing from the outside. However, what happens is that a lot of people I see as well have been in accidents, head injuries, and that sort of thing, headaches, chronic migraines. So there is at times an unwinding process that happens that brings on a memory of the accident that happened. So people may re-experience old pains that they thought they had finished with, but it's what's happening is that there's an unwinding that happens from the adaptation that they took to reduce the acuity of their pain.
So it's almost like you're going back to a previous trauma. You've held it, you couldn't quite express it in so many terms, and now with this release, it comes forth and comes out of your body.
And some people also have emotional pain that comes along with some problems. So there is often a release that happens emotionally. Some people have a profound sense of some spiritual loss that they've had and that sort of thing. So it's a very holistic approach, starting fundamentally with the structure.
So that would be the somato-emotional release, as Upledger.
That's right. That's the phrase that's often referred to. Somato means body, emotional release.
What I'd like to do is take a small break now, and when we come back, I believe you're going to show me what craniosacral therapy is all about, and I guess I get to experience it. So please stay tuned.
Craniosacral therapy is really indicated primarily for a range of ailments concerning the dysfunctions of cranial bones, and that involves traumatic head injuries, concussions, TMJ dysfunction, jaw joint pain. People have often as a result of problems with their teeth or problems elsewhere in their body. Sometimes it follows on dental work. Tinnitus, which is ringing in the ears, often follows from TMJ dysfunction. Vertigo, sense of people falling over and not having their balance. Migraine headaches are also very, very indicated for craniosacral therapy. Sinus infections, chronic sinus infections, and sinus headaches. With children, I see a lot of children for attention deficit disorder and associated with hyperactivity. And there is, in a large number of children with this condition, a structural element. Colic is also very, very amenable to craniosacral manipulation. I've had very, very good success with colic. Chronic ear infections, which plagues a lot of children, and they have to go on antibiotics, is often very easily cleared up with cranial work. And birth trauma. Often children are brought into this world with forceps or suction and or long labors, and their crania are sometimes very distorted as a result, and that can be very helpful. When children are finished with dental work, especially orthodontia, it can be very helpful to have a couple of sessions to balance the cranial bones. So it's something that is very helpful for a range. And you can be referred by your physician, or you can come in directly to see us and give us a call.